Good afternoon all, and we want to welcome una to the medical discussion over medical topics. And we will bring this program to you. Your name na Andrew Mosige, a third year clinical student from the School of Clinical Science. Well, from the previous episode, we don't talk about HIV, and we look at what they cause HIV, how HIV becomes transmitted, which are some of the misconceptions and the prevention. So we encourage everyone to go over them and go look at them so that you will get knowledge concerning HIV. And on today's video, we can talk about one of the disease conditions really affect so many people, especially in our country, Sierra Leone. We are there with one of School of Clinical Science student and the Stephen Conte. Welcome, sir.
Good afternoon. I'm Stephen Conte, third year medical student at the School of Clinical Science.
For ma'am. So on today, we can talk about malaria. And malaria is one of these diseases them we don't disturb Sierra Leoneans them all over. And with you, Stephen, we have enhance with the knowledge concerning malaria. So without much time, let we go. So Mr. Stephen, people are going for know what's in malaria.
So first of all, for start with, malaria is among the community. And malaria also the cause for most of them people have for visits the hospital setting, and also most of them admissions there, especially picking them and malaria they cause them now we hospitals them. So I therefore discuss about malaria, and as we all know, not only for Sierra Leone, but most of these West African countries and the world at large, malaria seriously affects people. Approximately over 240 million people actually they become infected by malaria, and it's important for me to discuss about malaria. And the malaria is a vector-borne parasitic disease where now these parasites they cause and when a plasmodium parasites.
Okay. So we need to know also who are the at risk for get this malaria.
Well, they in several ways in terms of the people and where they at risk for get this malaria. First of all, picking the way they under 5, then they are at high risk for get this malaria because the immune system not developed, and so their mind and their body not developed. And also pregnant women they also then they are at high risk for get this malaria, and people are where the immune system so weak. So now then 3 categories of people are they at high risk for get this malaria.
Okay.
And one thing for know again, as my brother knowledge states, and malaria, this plasmodium parasite they cause this malaria in the infect type.
Okay.
We get the malaria in the plasmodium falciparum, we get the plasmodium vivax, ovale, plasmodium malariae, and norisci. So among them 5 species of plasmodium there, the one way common of society is na Sierra Leone, na Plasmodium falciparum, accounts for 90% of all cases of malaria in our country.
Okay. So as we do malaria na a vector-borne, meaning na the mosquito they carry this parasite. Mosquito not only cause the malaria, but yet still the mosquito they act as what? A carrier. So if by any means this mosquito gets in contact with person who don't get already this malaria, if by any means bites another uninfected person, that person don't get the chance to get malaria. So the mosquito there just they act as a means for carry the plasmodium parasite. So we want to know also how would you distinguish between the fever in terms of malaria and that of typhoid?
And in terms of the fever, malaria, fever we normally they call one body and sudden in onset, and also and they go and come. So with high grade, that means the fever just the high. In terms of the typhoid now, and the fever is so gradual, then in continuous.
Okay.
So now one of the distinctions then and also I don't know if we try to know the way of manner in which this malaria they become transferred from one person to another. I think it's good for me to ask that question.
Okay. So we go to that. So but we want to understand because a lot of people that they outside the community, they say we get what we call typhoid malaria. Is it possible for a person get typhoid malaria?
No, it's not possible at all for make person get typhoid malaria. Although will be the come up now, so people in the say,
yeah.
but now two different disease conditions. Then they all get in different ways in which then they attack the body. So now, for answer the question, now two different sickness then.
Okay, so Fambulu again, this malaria and the typhoid now two different disease them, and then get to two different to move them what they cause them. The malaria link with parasites, whereas the typhoid links with bacteria. On to the next question. We want to know the mode of transmission, how person they become infected with this malaria.
So for me, the person they become infected in three ways. One of the ways the person they become infected with this malaria now where the female Anopheles mosquito, when are the major cause of this malaria, now they transmit these parasites to a human being, and it will contact the sick, the female Anopheles mosquito. And then secondly again, and through blood transfusion, where they donate blood, where they give blood. If me as a donor, me go donate blood, happy for find out say I get malaria, I go transfer to that person there. So another way again, through organ transplants, we are donate any part of my body so someone else also get malaria.
So we want to also know, because people and they say where you the wet yellow, where see yellow wet, they say get malaria. So how true is that?
Well, that's, let me say, not so true. Not so true at all. There are several disease conditions where maybe now some of the signs and symptoms and done there. But for malaria, I know we just say where you wet yellow and malaria, and we normal piece alone, normal wet, and for that herbal column, that pale yellow.
So we want to know also how the environment they play in terms of person forget malaria.
So the environment they play a key role for make person get malaria. Has the mosquito the type of talk about this female Anopheles mosquito. If the environment dirty, you need clean environments. Now a good site for like this mosquito laying egg them, and the population will become so large that then go plenty, then begin affect people. And also where we get stagnant water in our various communities is that then go to water then. Now a fine place for other mosquitoes that breed and multiply.
So people can get a conception back say outside here that malaria, they only get malaria where you eat too much of these foods like mangoes, orange, and that of oil. So what you go tell Fambulem outside here concerning that conception there?
I want to tell Fambule out there say that they not so true. Now false that one day. It's not scientifically proven say now mango, orange, or whatsoever they cause malaria. The only scientifically proven facts now that now this plasmodium parasites and they cause malaria.
With the mosquito they transmit.
Yeah. And then food stuff they are not get sensitive. So no food stuff not the way they cause malaria.
So how one can tell if you don't become infected with malaria? What are some of the symptoms in the show?
So if a person become infected with malaria, they begin see signs and symptoms then panel. One are this fever what they talk about this one body. And also it adds the person hear the arts, and the person they get chills and rigors, and also the person they get joint pain, the person they feel for vomits, the person they vomit. So now some of them signs and symptoms the person will present with we will begin suspect malaria until further test is involved.
There are other symptoms we go kind of show person outside there. We go tell say this particular person don't get severe malaria.
First of all, we classify malaria into two. We get the uncomplicated malaria, and then we get the complicated malaria. When we say uncomplicated, Now that the type of malaria we not that severe, although you get the malaria symptoms, then like down the way I don't mention this that fever, it will present with then signs and symptoms there, but you not get any organ damage.
Okay.
For the severe malaria, what they call complicated one, and get all these signs and symptoms there of uncomplicated malaria, then also it gets organ damage in the sense the person go out and color go get difficulty in breathing, fast breathing, respiratory distress, what we call. The person will go into coma, the person will get convulsions. So the person will in glucose level will go down, and the person will present with anemia when a decrease in blood. So anybody will presents with them signs and symptoms that with waiting I don't mention, so then life-threatening conditions that then with the time and say as complicated or severe malaria.
So we get people over there outside here. We are in, if they begin for feel headache, they take Panadol. If they feel fever, they take Novocaine. So what you go tell people for this self-medication?
And one thing which I want to make about them, whatever you experience now you also they feel it now, whatever part of your body where they feel, the best option for do not even go to pharmacy, go to hospital, meet a doctor, then go run testing for you, and upon that, we don't know when the test them, whatever they find out in the cause, then go prescribe the right medications. We go menu. Taking medications out blindly, you don't know the actual cause. That can happen to person. But now signs and symptoms very common to various disease conditions.
Sure.
So you going taking these painkillers or that medicine for just you feel saying a malaria because of you don't get one body and not several at all, and that not go help you, not go man, instead of it go even damage your system.
Okay. So
the best advice now that whatever you encounter now, whether your body or any parts of you, they at can hospital.
Okay. So we want to know also, because we get a whole lot of people already outside here, as soon as, more especially those people who didn't have the villages. We are in the hospital, maybe you know get clinic within the villages or the hospital far from inside, and most of them depend on the herbal medication. So what do you want to tell family concerning that?
And first of all, for in the treatment of malaria and also that disease conditions, but wait me know, no scientifically proven herbal medication not the way go treat malaria, because you not get the compound itself, the ingredients way for kill this plasmodium parasites are not get, and so any herbal medication we take maybe you go end up for relieve the symptom, but you know will cure the malaria. Time goes on few days or weeks, you go present with the same issues then back.
Okay, so what you go advise? What are the first line treatments for malaria?
So the first line treatments of malaria, whenever, for example, your body they warm, if they feel the signs and symptoms of malaria, the first thing they do, even they go ahead and take any malaria medication. If you do test, whenever you want to treat malaria, make sure say you do test first before you treat.
Okay.
So now that's.
So after the treatments, one will have to know the medications then.
So the medications then in several ways based on the type of malaria we get. We don't just talk about the uncomplicated malaria and the complicated malaria. These medications in terms of treatment then differ. For the uncomplicated malaria with no organ damage, it just, and the patient that tolerates orals, you just need oral malaria medicines. And WHO and the Ministry of Health National approved this antimeter and lupantine for treat the uncomplicated malaria, the TABs. Where normally we look with people and they call Bicotem. So one thing for know for this malaria, now this part of the country, when the Plasmodium falciparum the cause the only medication way for treat you need just treat her with one medication, now two medication, never treat this type of malaria where they get in Sierra Leone with one medication. So now for that, the WHO and the Ministry of Health in Sierra Leone recommend 2 medications, but in the come in one. This antimeter and lufantrine, what they call Bicotine. Now 1 tablet so but
they 2
now 2 medicines then they. So now that type of medication if for treat uncomplicated malaria, the tabs, they treat them for 3 days and they take them 2 times a day. When I say take them 2 times a day, no mean say then say take them morning and evening. If you get a specific time, we they see most of within the communities that they just prescribe medicine and say take them morning 10 and evening 10. No, before take them, before indicate the time.
Specific hour.
If this medicine they go for 2 times a day and in duration are 12 hours, tell the person say take at 6 p.m. morning, 6 p.m. a.m. and 6 p.m. evening. But in a general situation where you go take, let me say 6 a.m. in the morning and maybe 10, 11, and 11 p.m. You say now, so no, the medicine will work.
So for how about for the complicated malaria?
Well, for the complicated malaria, and we get a first line treatment for the complicated malaria when artesunate. So the artesunate, then give a 0, 12, 24 hour. The 0 hour where them immediately then do testing with this RDT, random diagnostic test, then find out say na malaria and now that severe form there. Then they give you IV artesunate immediately when at the 0 hour, then 12 hours apart then you and 24 hours then you. So after done, we know you need end there for treat severe malaria or for treat the whole lot of malaria itself. You get for treat to oral. IV then very fast in onset, but not effective. Don't need to eradicate the parasites unless you get for treat to the tabs where the patient will don't tolerate the oral, depending if you tolerate the oral. Then you go take the tabs, this Bicotine for 3 days, depending on in age.
So family we do so we really outside here we we begin to experience certain symptoms then, and the best thing we feel say go do now follow we take herbal medication. It's not the appropriate conventional way for use. So we do from Stephen Conte as he don't give you the treatment for malaria. So we want to wrap up this program and we try to ask if you will give family them some of the preventions and what they will take for prevent themselves from this malaria.
So one of the main effective preventions then for sleep under insecticide treated mosquito nets, where I hope say maybe every year the government of Sierra Leone they give people free. So when then you sleep under mosquito nets, we get people in our community wearing a jolly hang the tents up nine room and they put some down. Not when the entire pot talk, but if you don't go sleep around 7, 8 o'clock, put the tents down. By so doing it prevents over 50% of forget malaria. Then another thing again, cleaning of the environment. Before cleaning surroundings, before drain then stagnant water that way they settle in our areas then. So now some of the ways then this for prevents malaria.
So we get the habit for use this net for make goal posts. You use this net for go fishing. The net for let you use them for prevent malaria. And now we ensure say environment clean, because if we environment dirty, they create a whole habitation, a whole dwelling place for the mosquitoes, and it not go good. And also we need for CC we vaccinate ourselves. And as of now, we get the vaccine where they go on, more especially for picking. So you go very much good and fine if you go in for this vaccine for prevent yourself. So there comes the end for today's presentation and today's discussion. And we want to tell you all thank you for your attention, for your time, and also want to extend thanks to Stephen Conte for the time given.
And thank you, me Pambulem. And the last message now that even for Beloma, then the prevention of malaria is there. We then call fancy that way de Pambele They need forget this for prevent the severe form of the malaria. And also, malaria is very worse to belle woman there. It dey cause pikin for die inside you. It dey cause for make you born pikin wey not get the appropriate weight. It dey cause miscarriage. So, my family out there, if you say malaria are just a common thing, not a common thing again, no, a very, very severe. And the last message I would like for left to my family now that malaria is preventable, treatable, and incurable if they detect some early and with the right treatment. So thank you, my family.